Imagine you get a tiny paper cut. Within seconds, your body mounts a massive microscopic response to plug that leak. Let's dive under the skin to see how it happens. Floating right alongside your red blood cells are special proteins called clotting factors. Your liver builds these and sends them out to drift through your bloodstream in a deep sleep, completely inactive. But the moment there's an injury, the closest sleeping protein wakes up. That first awake protein taps the shoulder of the next one, waking it up, and that one wakes the next. This is known as a cascade. Think of it like setting up a long line of dominoes. When you tip the first one over, it hits the second hits the third, and the momentum builds with every single step. Your body relies on this multi-step chain reaction instead of a simple on and off switch to ensure your blood only thickens when there's an actual injury. This protects you from dangerous random blockages when you're healthy. This line of dominoes actually has two different starting points, depending on how the injury happens. We'll start with the extrinsic pathway. The extrinsic pathway is the body's fast emergency response. It kicks in when there's an injury to the tissue outside the blood vessel. The sequence to remember here is short and fast. Factor 7 hits factor 10. The other starting point is the intrinsic pathway. This is a slower, more complex response that triggers when the damage is on the inside lining of the vessel itself. Because it's a longer process, there are more dominoes in this line. The sequence goes from 12 to 11 to 9 to 8, and then 8 crashes right into that same factor 10. So whether the body is reacting to an outside cut or internal damage, both of these starting lines have the exact same goal. They both exist to push over factor 10. The moment factor 10 gets pushed over, those two separate paths merge into one single road. This is the common pathway. Here is where the real work happens. Factor 10, with some help from factor 5, hits factor 2. We call factor 2 prothrombin, and when it wakes up, it transforms into a powerful enzyme called thrombin. Thrombin then immediately acts on factor 1, or fibrinogen, changing it into a sturdy mesh called fibrin. Fibrin is the literal net that catches blood cells to stop the bleeding. To make sure that net holds strong, factor 13 acts as the final stabilizing glue. Also, a quick tip for your exams: factor 6 does not exist, so you can skip it entirely. Creating that fibrin net is the ultimate goal of every step we've discussed. Without it, the blood cannot solidify and the leak remains open. To keep these dominoes standing properly, the body needs two specific helpers. The first is calcium, also known as factor 4. Think of it as the support beam required for almost every single step of the chain. The second helper is vitamin K. Your liver must have vitamin K to build factors 2, 7, 9, and 10. Without calcium and vitamin K, the dominoes cannot stand upright. This is why a vitamin K deficiency directly leads to bleeding problems in newborns or people with liver disease. Now that we see the chain, what happens to the body if just one single factor is missing from the lineup? In a condition called Hemophilia A, the body is missing factor 8. As the internal pathway starts to fall, the chain reaches a gap where the 8 should be. The momentum stops cold. There is also Hemophilia B, where the gap is at factor 9. In both cases, the patient has plenty of blood. The bleeding continues because a missing link in the chain creates a dead end, preventing the body from ever building that final fibrin net. In the hospital, medical teams use blood tests to find exactly where the chain is broken. They are essentially checking which line of dominoes is failing to fall. The PT test evaluates the short, fast extrinsic pathway. The APTT test, which has a longer name, is used to check the longer intrinsic pathway. When caring for these patients, you must watch for hidden signs of bleeding, like blood in the urine or unusual bruising. You also need to avoid giving shots directly into the muscle and ensure that you use a soft toothbrush to prevent their gums from bleeding. Here are the sequences to lock in for your exams. For the intrinsic pathway, it's 12 to 11, 9 to 8, then 10. For the extrinsic, it's just 7 to 10. And the common pathway goes 10, 5, 2, 1, and 13 to finish. Understanding this chain reaction turns confusing lab values into a practical toolkit for patient care. It gives you the specific insights needed to monitor for danger and keep your patient safe.